America is in the midst of an opioid drug epidemic.
Commotion and using drugs.
Driven by escalating opioid addiction, drug overdoses are now the leading cause of death among Americans under 50.
People are literally dying in the street. They're dying in their parents' homes.
According to the Centers for Disease Control, the opioid epidemic is fueled by prescription pain medications.
Great job. Way to communicate, good eye contact.
Michael Israel dreamed of becoming an architect. In high school, he participated in a video project exploring the architecture of his hometown of Buffalo.
These buildings have been here for such a long time.
Michael didn't realize his dream. Despondent over an addiction to prescription opioids, he took his own life at the age of 20.
When Michael said, "I'm addicted," it was a big surprise. The next question that came out of my mouth was, "To what, Mike?" And he said, "He's pain pills."
The medical community has been overprescribing opioids. That's really the reason we're in the midst of a severe epidemic of opioid addiction.
The doctor did prescribe the hydrocodone for your knee pain. It's very important that you only take it as needed.
I think some physicians don't appreciate how potent these drugs are and don't necessarily appreciate how many problems they can create. How did the painkillers work out for you originally?
Started okay. Then I couldn't get enough.
West Virginia has been ravaged by a flood of opioids.
The epidemic we have in Ohio is fueled primarily by the pain med problem.
The opioid epidemic has spiraled as many addicted to prescription pain pills turn to cheaper and more available street drugs like heroin and fentanyl.
So Cameron was my son. He was wrestling and he broke his collarbone. So he was prescribed Percocet. I never in a million years thought my boy would be a heroin addict.
There's a lot of blame to go around. Patient demand, pharmaceutical companies, doctors there easy with a prescription pad. Health insurance came in that would pay for all this stuff.
I can't imagine anything else that would happen in our community that would be associated with that many deaths. I don't know where the outrage is.
It's very hard to get over this image every day and every night of your kid taking his last breath.
Michael was the child that could put the smile on your face, always. When Michael passed away, we just started questioning, how did this happen and why did it happen?
How did Michael get addicted? What happened to Michael? And then you find out we're all ignorant when it comes to addiction. We don't know very much about addiction because we never thought that it would happen to us.
According to the Centers for Disease Control and Prevention, the number of drug overdose deaths in America has never been higher. The majority of deaths involve opioids, including popular prescription painkillers like oxycodone and hydrocodone.
The problem's huge. The rate of deaths from prescription opiates has been exponentially growing, and that's only the tip of the iceberg in terms of how many people's lives are wrecked because of prescription opiates. It's a huge problem.
The most surprising element of this is how it's the legal prescribed painkillers that get people hooked.
Our young people see prescription medications as something safe and effective. A doctor has given it, a pharmacy has filled it, so they feel okay about it.
Michael's getting everything from our family doctor and 2 other doctors. We didn't know that that was all addicting.
He was taking his pills as prescribed.
He was taking his pills as prescribed.
People trust their doctor and they think that the doctor is prescribing things appropriately and monitoring them appropriately, and they think that if the bottle says take it in such and such a way that it's perfectly okay to do that. Hello?
Dr. Richard Blondell is professor and vice chair for addictions at the University of Buffalo and director of the National Center for Physician Training and Addiction Medicine.
How did the painkillers work out for you originally?
Started okay. Then I couldn't get enough.
That happens.
I wanted more and more and more. You keep taking more because you think more is going to be better.
And the more you take,
the worse you get.
The worse you get.
And the more you want.
The more you want. I think the majority of the time it's this, that doctors are trying to do a good job and fall into a trap and end up contributing to the problem. And was that bothering you when you first got on painkillers?
We've overexposed the U.S. population to prescription opioids.
Dr. Andrew Kolodny is Director of Opioid Policy Research at Brandeis University and founder of Physicians for Responsible Opioid Prescribing.
I think that the biggest problem has been well-meaning doctors who are intending to help patients with pain, but who are underestimating how addictive these drugs are and overestimating how helpful they can be when prescribed long-term.
That's enough for 15 days.
Yep.
The opioid epidemic is the unintended consequence of the increased use and acceptance of prescription opioids. It is made worse because many who become addicted to prescription pain pills eventually turn to cheaper and more available street drugs like heroin and fentanyl.
Before they're using heroin, they're opioid addicted, and that addiction develops through prescription opioids. The reason that we're experiencing record high levels of overdose deaths, the reason we're seeing heroin and fentanyl flood into non-urban areas, the reason we're seeing soaring rates of infants born opioid dependent or outbreaks of injection-related infectious diseases, the driver behind all of these problems is the increased prevalence of opioid addiction in the United States.
Used properly, prescription opioids ease short-term pain from surgery or a broken bone. They also manage severe pain for cancer and end-of-life patients. But the amount of opioids prescribed in America greatly exceeds what is required for those uses.
When Michael passed away, Avi was angry. He was angry that it happened, and it shouldn't have happened.
Yeah, there you go.
Avi wanted a dog so badly. And I said, there's no way I can allow us to have a dog because Michael kept asking for a dog.
We knew that Michael was in pain a lot. And towards the end of his life, he really suffered.
We were really terribly lonely. So I finally gave in, and much to my surprise, this dog has given us such joy.
Death changes you. It completely does. And you want to know, why did Michael have to die?
At the age of 12, Michael was diagnosed with Crohn's disease, a painful gastrointestinal condition. As he got older, doctors prescribed powerful opioid medications to treat his pain. After Michael's death, his parents obtained pharmacy records that showed Michael was prescribed 185 pain pills over a 1-month period.
I just couldn't believe that the doctors did this to him. It's indefensible that they did this to an 18-year-old, young man. Changed him chemically forever.
This thing takes a beautiful person and turns him into a monster. That's my beautiful little baby.
Yeah, who are you?
You know, what happened to you?
Yeah.
You know, what's going on? And you don't understand what's going on.
The reason that the United States is in the midst of a severe epidemic of opioid addiction is because the medical community began to prescribe opioids very aggressively. And as the prescriptions went up, rates of addiction and overdose deaths went up right along with the increase in the prescribing.
More than 240 million prescriptions are written each year for opioid pain medications, enough for every adult American to have their own bottle. OxyContin, Opana, and Vicodin are among the most frequently prescribed and most commonly abused prescription opioids. These powerful drugs can literally hijack the brain.
The effects produced in the brain by oxycodone and hydrocodone are indistinguishable from the effects produced by heroin. When we talk about opioid pain medicines, we're essentially talking about heroin pills.
It is a very powerful drug. It's a different addiction. The course for opiate addiction is you fall off a cliff. So there's no gentle slope downward with consequences and an opportunity to evaluate what's going on, it is right off the cliff.
With repeated exposure to a highly addictive drug, just about anybody can become addicted.
We're acutely aware of the fact that it's broad and it's not just one subset of the population that's doing it. It's kind of a problem that's affecting all age groups, all races, both sexes. That allows it to become bigger because it affects so many people.
Unlike previous drug crises in the United States, the opioid epidemic impacts rural, city, and suburban communities and touches every socioeconomic group. Opioid addiction is a 50-state epidemic.
Wyoming County is a rural county. Population approximately 23,000. Very tight-knit, hard-working type communities here. The mountains are beautiful here. I mean, the people are genuine and good people.
Oceana is a close-knit community. They're still good here, but through the years it's progressively gotten worse, and it is getting worse.
West Virginia has been hard hit by opioid addiction. It has one of the highest opioid prescription rates in the country and has one of the highest rates of opioid overdoses and deaths.
The majority of our kids are affected by drugs in their immediate family.
Good morning. In our career education class, we've talked about what do you want to be when you grow up?
We know that we have to meet their basic needs before they'll ever reach out to, English or math.
We're going to talk to each other, kind of be a sounding board. What does this career really, consist of?
Primarily, we focus on keeping and making our kids feel safe.
Got it?
And learning does take second to that. If they don't feel safe, how can we expect them to learn?
First of all, let me thank you so much for allowing me to come back to beautiful Oceana.
Senator Joe Manchin visited Oceana Middle School in 2011 as a newly elected senator. He came to talk about education and jobs, but the middle school students had other things on their mind.
So when I came down 5 years ago, that's what we were talking about the jobs opportunities. And then there were some students that wanted to talk to me. They wanted to share the life that they were challenged with, living in an area that become truly overrun by drugs.
Chelsea was a 7th grader when she met with Senator Manchin in 2011.
He came to our small community, and the conversation led to the problem with drugs in our community. Oceana is a wonderful town, wonderful people, great place to live, but then there's the drug problem. My mom and dad were divorced when I was in the 6th grade, and it was because of drugs. My dad was in a coal mining accident, and he soon after became addicted to painkillers. And he started putting those medicines before us.
Chelsea was in the audience when Senator Manchin returned to Oceana Middle School in 2016. The senator was hoping to hear more encouraging stories from a new group of middle school students. He didn't.
I think that what is wrong with our community, like the drugs in it, I haven't really seen a change because I don't know how it was like before, but my parents and my grandma and my aunt used to talk how it would be safe at night and you could
do whatever you want.
You could walk the streets and you wouldn't have to lock your doors and have a doubt about anyone, and now everything is dangerous and you don't want to go outside alone even in the daytime.
It's still that way here. You're still seeing that?
Yes.
My stepdad did him. He beat me and my mom, put a gun to my head's mom and me.
What do he want you all to do? He wants you to take drugs too, or he wants your mom to take drugs, or he was just out of control?
He wanted my mom to take drugs. She wouldn't do it.
Is he gone now? Is he out of your life?
He shot himself because of it after he killed my mom by shooting her up 3 times with Oxycontin. He didn't want a divorce. She did.
How old was your mom?
20. I was 5.
But to have a child tell you that my mother was shot with a needle with oxycodone, and the first shot killed her, but the guy shot her 2 more times to make sure she was dead. For a little 12-year-old girl to tell you that, now think about it. You've seen the horrific effects it's had on your families. You've seen death in your family at a very young age. No child should go through what you went through.
You know, this is life. This is how it is. Many kids don't know anything differently. They don't know that another world exists. You know, to them, this is normal.
I took away from that conversation just as another day. I live that day in, day out from a lot of the cases that we have here. Very sad stories, and I've heard just some horrendous stories over the years from this part of the state.
You heard their stories. They were worse than ours were for 5 years ago. My story, it's sad, but their stories were devastating. Like, it was very upsetting to hear those. It's unbelievable that it's just getting worse.
Every day we battle this, the effects of the drugs. We battle the addictions right here in school. They're precious kids, and they all have special qualities. We need to save their lives. We need to.
I would just tell them that they had their future, and I don't want to ever have to go through that with myself or my family that I will have in years to come. We don't want this for our children, so maybe, you know, maybe we're not doomed.
Children should not have to live like these children have had to live. They didn't ask for it.
Teacher Deborah Davis fights the opioid epidemic at school and in the community.
We are a faith-based organization. We're a nonprofit, and we were established in 2005 because families had nowhere to go.
So how was your group of students? They did really good.
So we started helping mothers and wives and children, and it wasn't long till we learned it was the community's problem.
Okay, we just got this back from the printers.
I focus on what happens if I don't do anything.
Take off.
For the longest time, no one would talk about anything. It was hidden. Therefore, it continued to get worse. So now, everybody's talking about it. Hopefully, we can stop talking about problems and start focusing on solutions.
The crisis of opioid addiction is a relatively new problem in America. Prior to the mid-90s, the use of opioids to treat pain was limited. 2 factors triggered the dramatic increase in prescribing opioids to treat pain. Pharmaceutical companies began telling physicians that opioid pain relievers were safe, effective, and non-addictive. Around the same time, doctors were being pressured to treat pain more aggressively.
There came out some new recommendation from professional medical organizations that pain is really supposed to be the 5th vital sign.
In addition to your blood pressure and your pulse and your temperature, we're also going to ask you, on a scale of 1 to 10, how's your pain today? And if your pain's a 5 or greater, then the physician feels a mandate to medicate that.
Taking 2 a day, so the maximum daily dose.
The medical community begins to hear that we've been allowing patients to suffer needlessly because of an overblown fear of addiction, that the compassionate way to treat just about any complaint of pain is with an opioid.
So there was a perfect storm of public demand for the treatment of pain, and the pharmaceutical industry right there creating a whole new generation of powerful drugs. Your hands are...
Pain is the #1 reason people visit a doctor. Pain can be a challenging element for doctors to diagnose and treat. But now doctors were being told they had a new way to treat pain that was safe and effective.
Don't be afraid to take what they give you. Often, it will be an opioid medication.
In the 1990s, new opioid medications were introduced to treat pain. Much of the information about these new drugs came from pharmaceutical companies.
Some patients may be afraid of taking opioids because they're perceived as too strong or addictive. But that is far from actual fact.
The reason that the medical community started to prescribe so aggressively is that in many ways we were responding to a brilliant marketing campaign. It was in 1996 that Purdue Pharma introduced OxyContin. It launched a campaign to encourage the medical community to prescribe opioids for common chronic conditions.
The marketing effort included paid trips for doctors to workshops on pain treatment and visits from drug reps who often oversold the benefits and understated the risks of prescribing opioids to treat pain. While OxyContin was the most successful of the new prescription drugs, other companies were producing painkillers and engaging in similar marketing activities. The aggressive marketing increased the use of prescription painkillers to treat common types of pain, from toothaches and migraines to sports injuries and back pain.
We start to hear that we shouldn't worry about patients getting dependent on the drug, that you can taper people off easily, and that this is the safe and effective way to help people with chronic pain. And what they were teaching was certainly wrong.
I would describe that as one of the factors that contributed to the current crisis, and that never should have happened. It's unfortunate that it did.
Ann Pritchett is Vice President for Policy and Research at PhRMA, an organization representing pharmaceutical companies in the United States. She previously served in the White House Drug Policy Office.
It's very challenging to look back at the history, and I don't think that anyone involved could have anticipated that we would be facing the crisis we face today. Do I think that if there's inappropriate prescribing and over-promotion and that's for profit, that needs to be addressed? Yes. Do I think that there was inappropriate behavior that contributed to the problem we're in? Yes. But do I think that that's the sole reason why we face the opioid crisis we do today? I don't.
The way that you can do well financially, the way that you can have a blockbuster drug, is if you can get the medical community to prescribe your medicine for common conditions, long-term conditions. And if it's a drug that's very difficult to discontinue using, well, then you've got a pretty good recipe for a blockbuster.
As problems with opioid medications emerged, pharmaceutical companies faced increased scrutiny. In 2007, Purdue Pharma paid $634 million to settle charges that it misled the public about the risk of addiction.
The epidemic we have in Ohio.
In 2017, several states filed suit against a handful of pharmaceutical companies accusing them of conducting marketing campaigns that misled doctors and patients. Despite the concerns, opioids remain one of the most prescribed drugs in the United States.
My issue is, why is there all this surplus product? I don't know why pharmaceutical companies are not held accountable to that. If there's only this much pain demand, but this much product, then obviously you know your product's being used for other purposes.
Since 1999, sales of prescription painkillers in the United States have quadrupled. During that same period, the Centers for Disease Control says there was no change in the amount of pain reported by Americans. There are enough opioid pain pills prescribed in 1 year to medicate every adult American for a month.
So clearly, we have a disconnect here. We have a situation where there's over-prescribing because it doesn't seem reasonable to think that for every American, there should be a 30-day supply of a prescription opioid. But how do we address that and still ensure that those with legitimate need are receiving access? I understand and empathize with the incredible pain and suffering that these families are facing. To blame the pharmaceutical industry as having the sole responsibility, I think, is misguided and wrong. I don't think that any one factor has led us to the current opioid crisis. It didn't happen overnight. It's not going to be solved overnight.
And the more you open up this Pandora's box, you find a broken system in this country where there's parts scattered everywhere. And there's people who need help, and they're broken, and they can't get the help because our healthcare system is based on making money.
Blood pressure's good.
It's always an issue about who pays for anything. We live in a capitalistic society, and our healthcare system is funded through payments, usually fee-for-service. So there's always a discussion about who pays for what and when.
The Department of Health and Human Services estimates the economic impact of the opioid epidemic at $75 billion a year. Much of that cost is borne by insurance providers, including government insurance programs such as Medicaid, Medicare, and veterans programs, and by private health insurers. Public and private insurers confront both ends of the opioid epidemic, paying for prescription drugs for pain patients and then paying for treatment when patients become addicted.
And we were extremely troubled by all the headlines that everyone has seen about the explosion of opioid abuse in this country. And we were mindful of the fact that often this starts out with prescription drugs.
Dr. Harold Paz is Chief Medical Officer for Aetna. He has an extensive career as a physician and healthcare administrator.
Because of the addictive properties of these drugs and the fact that they're very effective at eliminating pain, the pendulum swung way out, but at a tremendous cost and in tragic ways. We have to bring it back to the middle. When a physician writes a prescription for a narcotic, we depend on the physician to make the appropriate decisions around, does the patient need a narcotic? So our role is not to sit in the room with the doctor and second guess those decisions. But what we can do is look at the overarching patterns that exist.
Health insurers collect information about the prescribing patterns of doctors. Aetna initiated a program to contact physicians about their opioid prescribing.
We really wanted to focus on physicians that are writing a lot of prescriptions for opioids. We started with the top 1%, and we said to the doctors, based on this data, based on the CDC recommendations, you are an opioid superprescriber.
Along with the letter, Aetna provided a checklist for doctors to use when prescribing opioids. But some question whether letters are enough to address the problem.
We expect that our physicians are going to be well-trained, they're going to practice appropriately and professionally and ethically, and if they aren't, we have in our communities and in our states the mechanisms to identify that and make sure that those problems are corrected.
Patients and prescribers really need to understand that opioids are highly addictive. It doesn't mean that they should never prescribe it or that the patient should never take it. It means we have to be very careful with these drugs. We have to avoid using them when we can. And for many types of pain, we can avoid opioids. We have alternative treatments.